Hello everyone, my name is Dr. Joita Pal. I'm the emergency doctor, and today I'm going to be teaching you about the axilla. So the thing is that for a long time I used to be very much scared of this topic. I don't know why. I never understood axilla when I was in my med school, but while studying for the MRCEM, I found out that this topic is deceptively simple. It is very simple, very easy to understand, and let me explain this to you in just a short amount of time. Okay, let's go. So as you can see over here, it is a pyramidal structure. So like a pyramid, it has an apex, it has a base, it has an anterior wall and a posterior wall. uh, it has a lateral wall and a medial wall. It has a lateral wall and it has a medial wall. Okay, so just a pyramidal structure. What is the function of axilla? So the function of axilla is transmission of vessels and nerves into the upper arms is the main function of the axilla. Let us go into the borders of axilla. So this is a view of the apex of the axilla from above. The apex of the axilla is bounded anteriorly by the clavicle, posteriorly by the scapula, and medially by the first rib. Let us move on to the base of the axilla. The base of the axilla is basically an open structure. Okay, so like as shown in the picture over here, it is an open structure. There is not much covering it, but for the purposes of the exam, we can say that there are fascias and muscles and etc., multiple structures, etc. But the base is basically open. Okay, next we come to the medial wall. If you can imagine the triangle being over here, okay, the pyramid being over here, then this forms the medial wall. So the medial wall is bounded by ribs and serratus anterior muscle. So serratus anterior muscle are a group of muscles that originates from the ribs and then goes posteriorly and attaches behind. So we will learn about the serratus anterior muscle in the next topic. So as I'm talking about the medial wall, let me also tell you about the lateral wall of the axilla. So the lateral wall of the axilla, as you can see over here, is nothing much to be said. It is just the humerus. The humerus is just the lateral wall of the axilla. Okay, now let's move on to the anterior wall. So these are structures that are covering the axilla anteriorly. Pectoralis major, pectoralis minor, and subclavius. Subclavius is a very small muscle that originates from the first ribs and joins to the clavicle. So the function of subclavius is just to anchor the clavicle onto the thorax so that the clavicle doesn't move about. So we will talk about these muscles later on. Move on to the posterior wall. So this you have to understand. So this is a humerus over here. These are the ribs over here. Okay. So if you are to remove the ribs, if you are to remove the serratus anterior, and if you are to remove the pectoralis major, minor, everything, and you're just left with the scapula and the humerus, and you're looking at it anteriorly, this is what you get. Okay, so this is the posterior wall of the axilla, but we are looking at it from the anterior view. So the posterior wall of the axilla is formed by subscapularis, teres major, and latissimus dorsi. Okay, just a revision of all of the walls of the axilla. So inlet, you have the lateral margin of the first rib, the clavicle, and then the superior margin of the scapula. To the coracoid process, anterior wall, you have the pectoralis major, the pectoralis minor, the subclavius, and the clavipectoral fascia, just like I said. The medial wall is upper thoracic wall and serratus anterior. Lateral wall is intertubercular sulcus of humerus, and the posterior wall is subscapularis, teres major, latissimus dorsi. So these are the contents of the axillary fossa. So the coracoid process attaches two muscles. One is biceps brachii. Forget about the short head, long head. We'll come to that later on. And the one below it is coracobrachialis. This one. So this is the axillary artery. So you have the axillary artery. Then next to you have the axillary vein. And then these yellow colored structures are the brachial plexus. Move your van. Easy to remember. Move your van. So move muscles. You have biceps brachii and coracobrachialis. Then for van, you have a vein, axillary artery, and the brachial plexus. Okay. Next, you also have, like I forgot about this, you also have axillary group of lymph nodes in the axilla. How do you leave the axilla and move on to other anatomical parts? So there are three ways in which we can leave the axilla. One is very simple, the base of the axilla. So the base of the axilla not covered by anything, just leave the axilla through the base. So the vein, artery and the nerves all leave the base of the axilla through this region. Okay. Now anteriorly you can leave the axilla through the clavipectoral triangle. There is the clavipectoral fascia like it is shown over here. In the clavipectoral fascia there is a small opening. Like it is shown over here, the place where I'm circling. This is known as the clavipectoral triangle. So you can exit the axilla anteriorly by the clavipectoral triangle. Okay, so what structures exist the axilla by the clavipectoral triangle? The most important thing that you need to know is the cephalic vein. So the cephalic vein is the most important structure that exists through the clavipectoral triangle. The rest you do not really need to know. How do you escape it posteriorly? So the posteriorly you can leave the axilla by the quadrangular space. My mistake. Why can't you zoom this picture? I don't know why. Let it be. So you can exit the axilla by the space over here. This space is known as the quadrilateral space or the quadrangular space. You can call it multiple things. Okay. Like why would structures enter posteriorly? So that it can supply the stuff in the posterior compartment of the arm, which we shall come about in a later video. So, like I said, what were the margins of the superior border of the axilla, like apex of the axilla? So you have the scapula behind, you have the clavicle in front, and then you have the ribs over here. Through this, you can see the axillary artery, veins, and the nerves entering into the axilla, right? We have already known about this. So, what if these structures get compressed? What if these structures somehow get compressed? It could be either due to hypertrophy of the muscle over here, it could be because of the formation of an aberrant rib over here, which is also known as the cervical rib. In any ways, it could be because of trauma, it could be because of repetitive injuries, it could be because of over exercising, it could be because of multiple factors. It could also be because of cancer. So you have the apex of the lung below right over here. So if the apex of the lung develops cancer, it can sometimes push on the thoracic outlet, which can cause obstruction over here. So if by any reason there is obstruction in this part, in the apex of the axilla, this is known as the thoracic outlet syndrome. Okay, so by any reason, if there is a compression of the structures in the apex of the axilla, it is known as thoracic outlet syndrome. Okay, so we read about the axillary lymph nodes over here, right? So say a person develops breast cancer. So all of the lymph from the breast is going to be going and draining into the axillary lymph nodes, right? So what happens if we want to do a biopsy of this breast? What if we want to see if the breast cancer has spread to any other regions of the body? We take a biopsy of the axillary lymph nodes. So if the axillary lymph nodes come out to be positive, that means that there is nodal metastasis. That means that the breast cancer has spread beyond the breast into the lymph nodes and possibly to other outside regions, which can show us that the breast cancer has metastasized. So we need to take a biopsy or we need to do a surgical dissection of the axillary lymph nodes. So what happens when you do the surgical dissection of the axillary lymph nodes? This is where this picture comes over here. It is very common to damage this nerve, which is a long thoracic nerve. If somehow you damage the long thoracic nerve during dissection of the axilla, you can cause this. This is known as the winging of the scapula. Okay, so these are the two clinical relevances of axilla. So that's it about axilla. Very simple to understand. I hope I've explained it to you very nicely and easily. And then, so that's it. I'll study one more topic and come and explain it to you. Follow along for more such videos. Bye bye.